The Nigerians in Diaspora Commission has advised Nigerians living in China to be careful and take necessary precautions while staying indoors for now. And we might not have heard the last of the controversial hate speech bill, as the sponsor has disclosed that it is still alive. This is Plus Politics, and I am Felicity Ezewike. Welcome. Now, despite the outbreak and spread of the coronavirus, Nigeria's Ministry of Foreign Affairs seems to have no plans in place to rescue Nigerians residing in China. This was suggested when Mrs. Abike Dabiri-Erewa, Chairman CEO of the Nigerian Diaspora Commission, advised Nigerians living in China to be careful and to stay indoors for now. Joining us to have a conversation on this are two gentlemen. I'll start with Kayode Showebi, political analyst. Thank you very much for joining us.
Thank you for having me.
And of course, we have Barrister Jimmy Abia. Pleasure to have you
with you today.
Okay. We have Lassa fever locally, but we'll get to that conversation in a bit. Let's start with the position. It's already in Africa. We hear it's in Kenya. Coronavirus has spread, and it's spreading really fast. Now, the commission is saying people should stay indoors, don't go out, and all of that. And the Ministry of Foreign Affairs is saying there are no plans as of now to evacuate Nigerians. Over 10,000 Nigerians, at 2014 that we had the statistics, are still there. What's your reaction? Let me start with you.
Well, it's typical. It's becoming typical of, unfortunately, of foreign missions abroad. I recall some time ago when there is a similar occurrence outside the shores. The reaction of a country or a government to such situation is always like uncaring, or they act as if they don't care about what the welfare of Nigerians in the diaspora is. For me, a sensible or a serious government will be doing what the British government is doing presently, communicating with governments of China and looking at how to move their citizens out of that place, what the United States of America is doing. But unfortunately, there is no plan. I think we've gotten information about this coronavirus for more than a week now, and that's an ample time for a serious government to...
They have, to their credit, some would say, they've issued a public alert. I've forgotten what they call it, the actual word that they call it now, advisory to the public as regards the coronavirus.
Yeah, I agree with you. The advisory barely takes an hour to draft up, or maximum 24 hours. Now, what happens beyond that? What happens beyond just drafting advisory? What about the life of these individuals? So you see that the value that we place on Nigerians has been little. Nobody cares. Unfortunately, it's so unfortunate that we are not really particular about the welfare of our citizens, even those within the shores. How do we treat them? So it goes to tell you how the government of Nigeria is really, really caring, shows care or shows empathy, sympathy, or concern about the welfare of Nigerians outside the shores.
Let me bring you in, Barrister. The commission and the ministry says they're monitoring developments there, and they're in touch with the WHO as to know what the latest information is. But beyond monitoring, as at this time, we have the US has already evacuated some of its citizens, and they're planning to go back. We have Germany, we have Canada, we have the rest of them doing stuff like that. Beyond monitoring, don't you think it is time for the number of Nigerians living in that country to be evacuated?
Yes, I think the government should have done more and should be doing more. But you can see that our government hasn't, and this is not, I'm not just talking about this government, but over the years you have seen this kind of laissez-faire attitude to governance, a situation where government doesn't take the issues, affecting the citizenry very seriously. What I expected at this time is that Nigerian government, through its agencies like the ones you mentioned, should be communicating with Nigerians over there and also making arrangements to airlift Nigerians back to Nigeria, because there are some Nigerians who cannot, not because they don't want to, but who cannot, leave immediately, but who would want to. You see, you saw what happened in South Africa when there was that issue. There was that issue of xenophobia until one Nigerian individual decided to take up the gauntlet and do something about it. There wasn't really anything apart from statements being issued from government quarters. So I expect that more would be done, more should be done. And now this is about Nigerians over there. Now, what about Nigerians who are here? How much is being done to protect Nigerians who are here?
Yes, I was gonna come to that. We did try, just to say that we did try to get the Abike Dabiri, that's the CEO of the Diaspora Commission, but we couldn't get her to talk to us. She didn't respond to calls at the time we had to come live. But we'll keep trying to reach her to see if there is any updates that we might have missed. But for now, there was a statement by the Ministry of Health. The Minister of Health has come out to say that they've set up an inter-multi-sectional committee to enhance surveillance. They have started enhancing surveillance at the 5 international airports that we have, and they're hoping that they will do other things. They're also looking at the state governors in these 5 areas, because I mean, most of one of the ways it can come into the country is through the airwaves. Would you say that this is enough? They've also issued emergency numbers that can be called. Beyond that,
yes,
is there more?
Beautiful nomenclature. Beautiful idea, but when we talk about implementation, because this is where these things are important, you need to you should expect that the things they have mouthed, would be implemented. I expect that a number of agencies, like the minister mentioned, that a number of agencies would be involved in this, not just agencies under the Ministry of Health, but other bodies. You have the customs, you have the immigrations. I expect, especially the immigrations, should be involved in this process to ensure that people, people who are suspected, of having this particular, disease, do not come into the country. And if they do, that they are quarantined before they get into the general society, the public. So you expect that a lot more should, be done, and the government should actually be taking the front row in doing this.
Okay. As at 2014, okay, you wanted to say something?
Yes, I wanted to butt in. I was just thinking about it this afternoon, and I just hope that by virtue of mercy or grace of God, we don't have to battle coronavirus in Nigeria. I was doing a recap of what we've gone through with Lassa fever.
Yeah, well, I was actually going to have us talk a little more about, because that is our own health emergency as at this point.
We have that already, and how well are we faring with that? Not to talk of the one that we don't even have as much as information about it. We are not talking about the emergency procedure. We have our borders porous. Someone could have come in. I just got this afternoon that a student in Côte d'Ivoire already contracted, and is being isolated. And so we don't know how many persons are going to come through the unofficial means, the routes, around the borders. So the government, unfortunately, from what I've seen, they are not being proactive enough. I think we have ample time. By now, we should be seeing communications. National Orientation Agency should be on TV on a daily basis, informing Nigerians about this virus, how to mitigate against, how to sustain emergency. We are supposed to take this as an emergency issue, but nothing is happening. We're just having advisories and communication, just mouth and words. We need to do more. The government needs to do more. The government needs to show huge level of seriousness. Just last week, I was just passing by the airport in Murizala Mohammed here, and I think around, if I'm not mistaken, early in the morning, the immigration officers were just gisting. The machine there that was capturing as people were coming in was there, but those people who are supposed to be monitoring it, they were gisting, talking and all those things, and just 2 of them were there. So let's imagine that someone with this ailment actually came in. How will you track such? There's no level of seriousness. We need to do beyond this.
Okay, still on the coronavirus, before we move on to talk about, you know, how we're handling our own local situation here, the Federal Competition and Consumer Protection Commission, we understand this morning in Abuja, sealed off a supermarket over a confirmed allegation, that's how the papers are reporting it, of illegally imported seafood from China that was delivered to the country for fears of coronavirus. There are thumbs up for this move, but there are also those who are saying we're chasing shadows. What do you say?
Well, beyond the coronavirus, I think this is something we should give thumbs up. When government agencies actually perform their duties, we should actually commend them. We know that a lot of this, goes on around. You see factories that, don't go through the regular process of monitoring, by government agencies. You see factories that government agencies help to cut corners with respect to laboratory analysis and other things of their products. So a lot happens. Even in supermarkets, a lot. I know that if more, if they actually investigate more, there are so many more supermarkets that you find things like this. But now it seems that something is being done, and we would expect that more of this, happens. I don't want to limit this to just the coronavirus, because there are several other diseases. You have cancer, you have several other, ailments that people can contract by, taking unwholesome products, and you expect that government and its agencies should be up and doing and ensure that because for everybody who gets an ailment, one person could be related to that. I mean, this is something, it has to be an issue of enlightened self-interest at this point, that because one person might be related or even be the official of government, who may suffer this. So people have to take government job, as a responsibility, as something they have to discharge, to the best of their ability, because anybody could be affected.
NCDC has issued a statement. Part of that statement, press conference, and the comment they made was that they're working with the Chinese embassy in Nigeria to delay the return of those who have traveled, the Chinese citizens who have traveled for the lunar holidays, and they're saying that they're going to, there's some response. Do you think they can really stop these people from coming back into the country? Definitely.
The government has powers to delay because one of the ways to delay that is their visa. They can't come into the country without visas.
And what if they already had visas? People have booked their flights, they've planned their journey. I'm traveling on Sunday, I'm coming back in 2 weeks' time, and
visas get cancelled per time. And one thing I know the US has done is to quarantine people, restrict them to their homes, to make sure that they don't mingle with the public, for a period of time. Now, what the government is presently doing, saying they want to delay, they are talking to the government of China to delay their coming back to the country, is laudable, and we must encourage it. But beyond that, they must ensure that some of these citizens who didn't go to China directly, who are coming from other countries, are also delayed. This disease has been reported in so many other countries other than China. So we must ensure that, not focusing on China or Chinese alone, we must also ensure that we broaden the spectrum beyond people coming from China.
Okay, let's look at our local challenge. We have Lassa fever. This is, you know, the taste of the pudding is in the eating, right? Yeah. Yes, this is a sort of infectious disease as well. And so far, it is in 19 states of Nigeria. The death toll has risen to 41, even though they're trying to make a comparison with 2019 and this year. 41, 20, 42. What's the difference? One more and they will hit that figure. That's by the side. 41 people have died. What's your take on how we've been able to manage the spread of Lassa fever in Nigeria in preparation for something bigger?
I don't think we've done enough. If you go out on the streets and ask questions, I doubt that you would find a good number of people that know, and I'm talking about the urban areas. I'm talking about the cities. I doubt that you find a good number of people who even know about the Lassa virus. Now, that is for people who actually know anything about it. Now, what about prevention? How much do people know about the prevention? How much do people know about the symptoms? How much do people know about the treatment, that it should be administered? So there's a lot, and I don't think enough information is being passed out there. What is the Ministry of Health doing about informing the public, about sending out the relevant information to the public? Of course, he has mentioned the National Orientation Agency. I think they also have, some work to do, in terms of passing the relevant information out there. Also, the Ministry of Information. These are ministries and departments that have, critical role to play in ensuring, because information is power. I think if we have, you could see what happened during the Ebola virus thing. Information was out there. Information was, so much out there that even in worship places, you had, the priests, you had the imams, informing people, telling people, how to go about this. Please don't shake hands. Please, once you're leaving, please use the sanitizer and all that. You had it in schools. You had it everywhere. You had this information all, out there. But nothing that much is being done about this Lassa fever, and I expect that government should do so much more. We haven't even scratched the surface. We are just counting numbers and comparing numbers, whether it's less than what we had. No, even one person is enough. It is enough to have it as an emergency, because the propensity, the likelihood of it getting to other people is so much that we shouldn't take it as something, we shouldn't take it casually.
We have 5 centers currently for diagnostics. The Center for Disease Control says they're planning to have more. Since I think that as of 2012 we had just 1. So if you calculate in less than how many years, we have 5. Yeah. But is it enough, considering the population of over 180 million Nigerians?
When you were talking, you said they are planning to have more. We have an emergency on our hands, and we are still at the planning stage. Now, it's not like we are envisaging this to fall on us. It's already here. So we should have left the portion or the stage of planning. We should be at the portion where we talk about doing. I expect that every state of the federation should have a diagnostic capacity to diagnose this ailment. Have a quarantine station for every case. And ensure that emergency response procedure is very close to the people as much as possible. I expect that government should have set up mobile emergency buses to talk to people. Those were the things that we saw when Ebola virus break out then. I can recollect the response of the government of the day then. They sensitized people, they met with community leaders, they went to hospitals, they kept on orientating people about it. And that was the reason why they were able to come out of that challenge. But unfortunately, I haven't seen that much energy in this dispensation. It's so sad. And we are not just talking about challenges of, we are talking about 41 persons dead now. Now, about, I think, over 200 persons had been reported to have still been quarantined and all those things. And the number, those are the people who we had seen. What about people who had made contact and are still floating around? And Nigeria is a population of about 200 million people. So you look at it, the effort of government vis-a-vis the impact when this thing actually begins to manifest, they are not doing enough. And I'm using this opportunity to plead with the government. They need to do more. The Minister of Health need to declare emergency on health in Nigeria. They need to make sure that the clinics in Nigeria are very functional. We have thousands of them. What are they doing? Can people get information about this virus? Are the clinic staffs going out to reach out to hospitals, to schools, to estates, to inform people? We are talking about even urban centers now. What about the villages? These people are still even eating this bushmeat and all these things that could cause this ailment. People are still eating it. People are still touching them.
Both of you have hammered on enlightenment, and there seems to be a tendency for a recline once we get through a phase of the outbreak. As of 2019, after the Lassa fever, we didn't hear much about what the virus is, how it is spread, what we need to do to keep our environment clean. And now that it has come again, we're talking about what can the government do to ensure sustained awareness on Lassa fever and that rat that spreads it.
Yes, I think what the government should do is to ensure that its agencies work to capacity. Now, there are all these agencies have their work cut out for them already. But it's unfortunate that these things, they wait for the emergencies, to happen, before they even start doing anything. So I expect that the agencies of government should stick to their roles, perform those roles which they have, because they have the duty of informing, of ensuring that the healthcare facilities are in optimal capacity, and you also expect that funding should also be available to ensure that these things work. Because when you also talk about the agencies, you also note that some of these agencies are not as funded as they should. What is our health budget? What is the budget for health, annual budget for health? So you also expect that government should ensure that there is adequate resource, for health allocation, proper resource allocation to health services, so that these things can go on, regularly. It's not something that it should happen only during emergencies. It should be an ongoing thing. So. Yeah. Okay.
The NMA has come out in condemnation of the preparedness to manage emergency, especially for infectious diseases, and they are saying that more needs to be done. But I want to turn the table and ask, do you think that maybe the NMA, that's the Nigerian Medical Association, can do more than, issue statements if there is something else they can do to pressure the government to up their game and improve facilities in hospitals?
The Nigerian Medical Association can only plead with the government, unfortunately. I say that because what is even the capacity of doctors we have in our society? Every now and then, our medical staffs, officials, actually move out of the country for greener pastures. So at every little opportunity, what is the welfare of medical practitioners? In Nigeria, they are not encouraged enough. The capacity is not there. In Nigeria, I think a doctor attends to an average of about 1,000 persons per annum. Whereas abroad, it's quite cheaper. Yeah. It's quite lower. Now, what I'm saying is they can only plead with the government. The government will always do whatever it is they want to do. Bulk of these decisions are taken by politicians. These politicians don't use Nigerian hospitals. They actually go outside the shores of the country to get their health. Unfortunately, and it's headed by even the first citizen of the country. These are people who benefit from medical tourism. So you wouldn't get so much productivity when you say they should push the government. The government will only be pushed when they also benefit from it. Now, whatever medical budget we have or allocation, they don't get a pick of it. If you look at the budget of the hospital in Aso Rock alone, you'll be shocked that it's far bigger than a lot of the hospitals in countries. So I'm not saying that we can't do more, or we can't get more from government, but I think that even the Medical Association can only plead with the government, and we'll continue to plead with government. I hope
All
they
right.
are listening to us. They
Thank
should
you.
be sincere with the citizenry. I tell you, this society is ours. This society is the whole of Nigerians. Thank you.
Thank you very much. Thank you so much for your thoughts on the program so far. All right. Up next for discussion is the controversial hate speech bill. It's still very much with us. Stay with us.